Who's that?
Hey, we're live.
Oh, we're live. Oh,
wow.
okay.
So you start a show about healthcare, ingesting smoke.
I'm not ingesting smoke. I'm actually ingesting vapor. So the difference is important.
Whoa. Not everybody talking all at once.
Ingesting smoke. I'm not ingesting.
All right. So let's start this way. Before we even get into all the bullshit and craziness,
right?
Let's start. Who are you? And before any other questions get asked or anybody jumps in to ask us anything, what qualifies you to talk about healthcare? I just want everyone to know who we're dealing with and why I asked for you two to be on separately from all the other chaos and the battle royales that I do. Andre?
Who? Me first? All right. So I'm Andre. I'm from Jamaica originally. I came to Brazil on a scholarship to the University of Sao Paulo to do dentistry. So yeah, that's it. I mean, I guess I'm Brazilian trained, which is for a Jamaican, that's rare because Jamaicans rarely come to Brazil. And yeah, I don't know what makes me, I guess because I'm a dentist and, you know, in Brazil.
Hey, why are you qualified?
Why am I qualified? Because I'm a dentist. I studied in the Brazilian public system.
And what did you get after you got done studying? You hold a
DDS.
So your title is actually
Dr. James.
Thank you. Why did you make me pull that out of you? They're wondering
because it's weird. I don't like saying Dr. James. You know,
but that's not. I don't care. That's why you're here. That's why you're here.
Jeez. Okay, fine. I'm Dr. James from the University of Sao Paulo. Okay.
Oh, Mo.
Wow, Dr. J. That's smooth as he drinks his purple drink.
Yup.
My name is Maurice Dubois Gregory III.
Nice.
I have a BSN in nursing and a first bachelor's in psychology. I've been in emergency medicine starting about 15 years ago, and I'm currently a doctoral candidate for a doctor nurse practitioner. I studied public health. I work inside the I intern inside the Indian health system right now, and my current research is on finding ways to stop stop barriers to healthcare access, especially among minority populations.
Nice.
Wow.
Nice.
That's pretty heavy. Well, what I want to do to really get the ball rolling before we even talk about anything else, I want to know, how do we define healthcare? How do we define what healthcare is? And you know what? Since Andre, I gave you the first introduction.
Right.
Mo, can you give me your definition? This doesn't have to be a textbook definition, but just so that we can all know the words that we're using. How do you define healthcare?
I feel that healthcare is most importantly needs to be an egalitarian system that allows access for all individuals to seek primary prevention and primary preventative healthcare. When I say primary, secondary, and even tertiary healthcare prevention, I'm talking about what some countries do really far better than the United States, and that is primary prevention, which is your basic checkups and stopping things before we have to do these secondary interventions. And secondary interventions are screenings and things like that. But America, unfortunately, focuses a lot on tertiary prevention, which is the crazy quadruple bypasses, and we're doing like insane things, but maybe we could have started this process years ago with that same patient and found a way to stop it there. So for me, the most important part of healthcare is that initial gate or primary prevention. So that's my focus, my interest. I think that all healthcare should be focused on that.
Wow.
Right.
Wow. Thank you.
Yeah, that's good. I mean, for me, what does healthcare mean? For me, health, and this is like a basic textbook definition, but health is basically, you know, a human being that is in a state of wellness, right? And I think that wellness has to do with both physical, mental, and spiritual, you know? So that's basically what healthcare is to me. Here in Brazil, we do things a bit different. You know, Brazil focuses a lot on preventive medicine because we have a public healthcare system, the largest in the world. Because here in Brazil, healthcare is a human right, which means that it doesn't matter whether your immigration status doesn't matter. You know, as long as you're a human being in Brazil, you have access to the healthcare system, no charge. Everything comes from taxes. So, yeah. So for Brazil, it makes sense for us to like invest in preventive medicine because all those surgeries cost money. Prevention is always cheaper than cure. So,
Yeah.
in Brazil, that's what we focus on heavily. Preventive medicine, and we are very conservative when it comes on to surgeries and medication in general. We try to avoid that, and the only way you can do that is making sure or trying to lower the possibility that that person contracts that disease or that illness or whatever. So, that's how we do it in Brazil.
Well, here's something I want you to give us the story. When you talked about conservative medicine,
Right.
the story about when you were interning, I suppose, in Wisconsin, I don't know where it was, the story of the man and the tooth.
Oh, right. So in Brazil, right, as I said before, we're very conservative when it comes on to meds, right? Mainly antibiotics. We are very, because one of the problems that America is having now is what you call superbacterias. Because in America, people give you antibiotics very easy. You're prescribed antibiotics very easy. In Brazil, a lot of the cases, for example, I was interning and the patient came in with what we call dry socket, right? And that normally happens after an extraction. So the socket, it gets inflamed, stuff like that. You might have a bacterial infection. In Brazil, what we would do, we'd apply salt and water. So that's what we tell the patient. Listen, go home, use some warm salt and water for, a week. If it doesn't get better, we can give you some meds. In America, it was right away. Like for a patient, because in Brazil, the population is not as, how can I put it? The spending power is less than in America. Sometimes when you deal with the public healthcare system, you have to assume that that patient probably doesn't have the money to buy those meds. So
Okay.
you try as best as possible to use things that this patient has access to, before you put them in that position where they probably need to do that. And warm salt and water is one of the things that we use a lot over here.
I want to say, I agree with the most to your point. I think that one thing that we have to look at is the fact that many people think that Americans have a lot more buying power. We have a lot more access to credit. And those things,
Right.
Real buying power and credit are not the same. So I'd say that one of the big problems and why people almost have an interest in immediately getting medications in America is because our healthcare system is very expensive. If you go to a physician, you want all of the things. You've got drugs, you've got antibiotics, you've got whatever. We expect to have that because we don't get healthcare here as a standard service, and it's not guaranteed to us in the same ways as guaranteed in other countries that have more socialist views of how the healthcare system works. And so it makes it more of like a product consumer thing as opposed to a service thing. And when you look at you kind of almost think about going to the doctor's office in the same way you're negotiating to purchase a car or do something like that. And you expect all those extra things. I don't want the tinted windows. Antibiotics may work. Why not just get them now? And it is a huge problem here. I totally agree with your overall sentiment.
It's funny you said that. It's funny you said that because I recently had a conversation with a friend of mine, and what happened was one of our friends, he said that he wanted to look for a dentist here in Brazil, right? And our other friend commented, he was like, I don't really like dentistry in Brazil. So we're like, okay, why? Well, went to do a cleaning, and the dentist, all he did was a scaling, which in dentistry, that just means use the machine and you clean the plaque, right? Calculus, actually. So he was like, I didn't like it. I was like, okay, why? Because they didn't apply fluoride paste, right? And fluoride paste is actually a drug. Fluoride is a drug just like any other drug, and all drugs you have to use sparingly and you have to be intelligent when you use it, right? Because one of the things that happens in America is that every time a patient gets a cleaning, you apply fluoride, which isn't necessary because in Brazil, we only use fluoride with high risk patients. So if you are a client, a patient that brushes his teeth every day, you have no signs of caries. You have no signs of like large plant buildup. You don't need fluoride. You don't need dentistry. You don't need fluoride from the dental office because you already get enough from your water. You already get enough from your toothpaste. You know what I'm saying? So to him, he was like, the dentistry is bad in Brazil because they didn't give me meds.
Wow, you know what? I've seen that.
Which kind of goes back to your point that you made. You know, it's like it's like I'm paying for this, so give me everything you got.
Yeah,
that more is better, because I also know that we've been dealing with drug resistant infection.
Bacteria.
In the Brazilian jiu-jitsu world, we talk
bacteria.
about things like MRSA, which is staph infection that's essentially incurable. You'll either die from it or you won't. But all the medications that they give people simply isn't working because we've spent so much time and money trying to destroy all the bacteria, and everyone needs antibacterial soap, which just isn't the case. But one of the things that we talk about the micro issues of things like the fluoride, but on a macro scale, and this is something I shared with both of you, and I want both sides of the coin.
Right.
I'm going to use Brazil as an example because that's what I have in common. The United States, granted, all of the medicine and medicinal treatments in the United States are astronomically expensive. But on one side of that coin, I have clients in that industry who tell me it's because we do all the heavy lifting. We do all the research, we spend billions of dollars on every single piece through our government or our private funding or our universities. And then when we make the product, every other country in the world steals it. Now, on the other side, you have the case of Brazil, who found that there was a very, I don't know the name of it, there's a very good HIV medication. And when they found they couldn't afford it, they simply decided, you know what, this is HIV medicine, we're not stealing technology, and we're not stealing gold. They simply stole it and administered it. And the HIV rate in Brazil, it was one of the successes of the modern world, the way they applied that program. And I want both of your, I mean, Mo, can you give me your opinion on that? Because I think there's some merit to both sides.
Okay. I was going to say, I don't know how much merit there really is to the side that the problem is other people are always stealing it and we put so much into R&D. I think that's pretty false, and it's a common thing by drug manufacturers. A lot of these drugs are manufactured with R&D or research and development grants paid for by American taxpayers. So that upfront cost that they claim they have to eat is actually eaten by the American public. I think the drug
does that negate the issue? Does that negate anything? Does that negate anything, the fact that it's the taxpayers taking that issue?
Yes, because we shouldn't be charged double for it. It doesn't make any sense that if we've already paid into the R&D of this product or this drug becoming manufactured, that now we need to pay higher prices to purchase the drug later. And it's because it's a capitalist mindset that all that needs to happen is that money needs to be made from it. And if you can double charge someone and get what it's really pretty much capitalism and the way it works sometimes in large drug companies with like the way lobbying and things like work for our congressmen, it's whatever you can get away with. And the levied fines, the levied punishments are just a cost of business, and they do not equal the same amount of money that they make off of it. If I know I can make $10 billion off of the selling of a drug manufacturer by bilking $1 billion from American taxpayers, and then maybe get maybe a light fine of $500 million, that's a good investment. Why would you not do that? It's almost imperative that corruption happens on those levels to make it happen. Other countries have stronger legislation, better campaign finance laws, and things like that that make the government become a middleman, like a foil between consumer interests and corporations. But in the United States, we like those things together. So we prefer, for some reason, we prefer our senators and other groups just to be mouthpieces for those large corporations and just doing their bidding. That's the reason why drugs are so expensive. And other countries just don't put up with it. Either you're going to work with us and sell drugs at reasonable prices, or you're not going to do business here. And I think that's a reasonable way that it should be.
Interesting. Well, to your comment, what you said that Brazil controlled its HIV rate because of those drugs. That's not actually the case. Brazil controlled HIV because of preventive medicine, not breaking those patents, right? Breaking the patents were, and actually it's funny because only one patent has been broken. Only one for one medication, just one. You know, so like if you really think about it, that whole program that Brazil started was really, you could say, a failure. You know, so that's not really the reason why the drugs isn't the reason why Brazil controlled HIV. So Brazil invested heavily into sex education, heavily. Like in Brazil, you can go to almost any public place and you'll find condoms. You go to the subway here in Sao Paulo, you go to the subway, you go to the bus station, you will find condoms all around. You know, sex education was super important. So that's one of the reasons why, that's actually the main reason why Brazil controlled HIV, you know? So yeah. Yeah, that's all I'm gonna say.
I think that's excellent. That kind of goes back to the main point of that huge focus on primary prevention is always the better way to deal with problems. And when you have to go behind, we're doing tertiary prevention now to come up with these miracle drugs to stop what is a very, very pretty well evolved virus now. HIV, it's like gonna be expensive, but it doesn't have to be as expensive as it is. So those two things both add cost to it. You know, we don't have universal healthcare here, so we're missing that primary prevention step. And often I find that when I get people that have HIV status, they don't know about it because they can't get into a position. Yeah, they can't get to a test. They can't afford the healthcare to get to it. And I often encounter them maybe like when I was doing prison nursing or during those times. It's a surprise to them, and now we're behind the 8 ball trying to make up lost time.
Say that again, prison nursing?
Yeah, I did my internship at D&E, which is it's just the medical wing of the Department of Corrections here. And that's where we get like a lot of people with these primary prevention concerns because they're homeless or they're poor. Most people commit crimes for reasons of desperation. And so by the time they get to us, they've had that like, you know, that cavity that's been there forever, can't afford to go to a dentist. And so now we're trying to catch up. So it's far more expensive than just treating it initially by treating people like they're humans as opposed to people we can sell products to. And patents, you know, breaking patents is like, maybe I'm like on the side of the super left wing, but patents don't matter more than lives. A piece of paper is not more important. Are drug companies in the business of making patents or in the business of making sure their medications are getting to people? And so in Brazil, that you're more on the side of people and you hear more about patents, which is sad. I think it's wrong.
Wow.
Right. I think one of the things that I would have to say is that let me fix this real quick. Right. So one of the things I would say is that so if you look at a lot of the countries that implemented a universal healthcare system, right? That was normally done.
Universal healthcare for the people who don't know.
Oh, it basically means that health is a right, a human right, and everyone should have access to it. You know, you have different countries, you know, different countries, for example, like Canada, every Canadian and permanent resident has access to the healthcare system, right? So that's different. Whereas in Brazil, it's every human being. So different countries have, you know, they work on a different scale. In the UK, it's the same thing. Brazil is the only one of the largest country, actually, because we're the 5th largest country in the world. So Brazil has the largest healthcare system, the largest patient base, because every person in Brazil should have access to healthcare. So getting back to the point I was trying to make is that so a majority of the times when you look at history and you look at these countries that implemented some form of like public healthcare, right? You realize that happened after like a major tragedy. Like something has, for example, like in Brazil, it was after a dictatorship. A lot of people died. It was a rough time for Brazil. In the UK and Europe, it was after World War II. Europe was destroyed, you know? So you're looking at like so America, in my opinion, America has never really experienced like destruction on a large scale on American soil.
I don't know if that's true. I just think that we prefer to use the hope and prayer method.
What I'm trying to say is this. One of the things that Americans will say is that I will not pay for your health care. Why is it my responsibility? But when something really bad happens and destroys your country, shakes your country, at that point, you become a bit more communal when you think. And that's one of the reasons why in my opinion, in the UK, in Europe and in Brazil, people, when those systems were built, it was built directly after some tragedy, some major tragedy, because at that point, everyone needed everyone to help. You needed somebody to help you because everyone was in a bad position.
I think that important thing also to real. I kind of disagree with the fact that we haven't had a tragedy here, because we have had tragedies here in the United States.
Like,
they just haven't happened to the white Americans. The sickle cell crisis in the 1970s was huge. There was no research into it until the Black Panthers pushed programs to do sickle cell testing. The government had no sickle cell testing programs. HIV and AIDS, not a huge problem until it affected Brian White in about 1986. The problem had been raging since 1978 with tens of thousands of gay. Oh, I'm sorry.
For people who don't know, because this is a generational issue, you know, because you're in the medical field, Andre may not. Do you know the term Ryan White, Andre?
No.
Oh, okay. Let me explain that then. Ryan White was an elementary school kid that contracted HIV from a blood transfusion because we weren't testing blood in that kind of way. The CDC had warning signs back as far as I think the late 1970s and early 1980s about a disease called Kaposi sarcoma, which a lot of gay men in San Francisco and California were getting, but they didn't quite understand why. And lots of people were being affected by this. We're talking hundreds of thousands of people probably died, and millions after that, even after we started the gears rolling. But until Ryan White was affected, and they had discriminatory policies against him even being able to go to school and learn because he had HIV, people change?
No one knew how it was contracted, and he fell outside of the statistical norm. What they found in the beginning was we find all these gay men in this city who has it. As a matter of fact, at one point, the label was gay-related immunodeficiency syndrome.
Yes,
they called it. But people didn't know how it was spread. There were people who genuinely thought you could shake hands. So while I am never for the ill treatment of a child, fear makes people do crazy things. And when you have parents who relate HIV to chickenpox when they know that if their child goes to a school and his buddy has chickenpox and they high five, your child gets chickenpox, for the uneducated mind, and most doctors had no idea what this was, it was the same thing for them.
And I think it's important to look at why we were ignorant about it, because we weren't spending money on research to find out information, because it was only affecting gay men. And so no one cared. We can say well, people were afraid, but people were afraid because they were ignorant, because they chose not to study it. It happened in 1978. And we can see why, if you look at the exact same timeline of deaths, United States versus some European countries, I believe there's a couple Norwegian cases of people contracting HIV. As soon as they realized that something was wrong, because they had better surveillance than us, because they believe in primary prevention and we just don't, they were like, this is problematic. They looked into it and they were far above us. If we look at the documentary, the Dallas Buyers Club, these drugs, nobody didn't know about it. American physicians and American healthcare system was behind the 8 ball because we chose not to research it. And that's what caused the problems and confusion. So it took, this is years. This is almost a decade after we saw those initial cases, before people were starting to do something, and they acted in fear. But it didn't have to happen that way if we had better systems set up and more money put into it. The same thing with the crack, the same thing with many other health epidemics, whether it's crack and now it's opiates and we care, whether it was HIV until it became a white people problem in mainstream America, whether it was syphilis until the Black Panthers brought it to the forefront. All of these issues are crises that destroyed minority communities and disadvantaged groups. So we've had those crises.
But that's
we just choose not to compare them to American.
But that was the point I was trying to make, though.
All those. I guess we're along the same thing.
All those examples you stated were examples for a minority group of people. It wasn't. It wasn't the entire country. America has never experienced destruction on the scale of World War II.
I just think there's more than one America. So I think that's important.
I understand what you're saying, but I'm saying as a population, because in order for you to, and this is my personal view, in order for you to implement a universal healthcare system, there comes a point where you have to identify as American. Every person has to identify as American, and that's one of the problems in America.
You lost me. You lost me, my friend.
No, what I'm trying to say is that in order for somebody to take in order for a country to implement a healthcare system, right, that comes from taxpayers' dollars, everyone has to understand, right, that they're being equally benefited as someone else, as the next person, right? Mo just said that in America, there are many Americans, right? So basically, if I'm from a different America, the fact that I'm going to use my taxpayers' dollars to help you in that side of America, that rubs me the wrong way. I won't do it, right? Which is different from, for example, what happened in Europe, where when the country, for example, the UK, when the country was brought to its knees, people weren't thinking necessarily about, oh, you're from that side of the UK, you're black, you're this, you're that, because everybody was in a bad situation, right? So it was easier for you to identify as being British. We need to help each other. Whereas in America, in my opinion, Americans don't really identify as Americans in general. There isn't a sense of national, I guess, togetherness. So it's kind of hard to implement a universal healthcare system in a system like that.
We're definitely more individualistic.
Right,
Yeah.
because people don't, for example, like here in Brazil, you're Brazilian first. All Brazilians, it doesn't matter if you're right wing, left wing, center, we all agree that healthcare should be a human right. Because at the end of the day, you're helping Brazilians. You're not helping black people, you're not helping white people, you're helping Brazilians. And everyone identifies that at first.
Do you think that that's a sentiment that's from most people? Or do you, because I don't know if I feel that most Americans, because when we look at Medicare or Medicaid or other socialist systems that help like all of those groups of people, they're very popular. I think that the sentiment against single payer tax systems is one that is wholly funded and propagandized by large insurance company and corporations.
No,
I don't feel that it's a real sentiment.
Stop for a second.
Let me see if I get this right. So you're saying, hold on, let me see if I get this right. So you're saying that Americans have no problem with a universal healthcare system. They would willingly have that get cut from their taxpayer dollars. That's what you're saying.
81% of people believe in Medicaid. It's pretty universal. It's just.
But Medicaid is different though, because Medicaid covers this. Medicaid, first of all, Medicaid is insurance, right? Which is something that Americans tend to mix. Like, not because you have insurance means that you have access to healthcare. Because as a dentist, I don't need to take your Medicaid. I don't need to, and the government can't force me. So insurance is not healthcare. Insurance is not access.
Well, there's still single payer systems that allow for access to healthcare. And when we look at like that overall sentiment, I think it's pedantic to pretend as if we're okay with Medicare, Medicaid, the military, all these other groups that are really socialist systems that we all pay into, that we all get a benefit from. But suddenly when it comes to the idea of a single payer universal healthcare system, we're opposed to it. Most of the people that are opposed to it and people that push that anti-ideals, because we have we have fake grassroots movements here. We have entire systems and groups of companies and corporations that are designed to create dissent to things that would hurt their bottom line. And so I don't know if it's as wide as a sentiment that most Americans don't believe this is a problem, or it's most politicians and most people that are in special interest groups echo chamber that. I know before the break we had talked about how like the power of echo chambers and things like that. The way that medical corporations and medical insurance companies work, it's an echo chamber of pushing across this propaganda that most people probably don't believe in. Like, most people don't feel okay with the way that the healthcare system is now. But when we have senators that are on average take $30,000 from health insurance companies, not shockingly, these kind of big issues never become policy.
Right. Okay, so you're saying Americans want universal healthcare, but
politicians want not to die. I think people in general want not to die and not to pay money for high expensive stuff. You say like this is something that works great, people would be interested in it. But you throw in like the political machine and the way that it works, because everything like the red and blue team in the United States of like Republicans and Democrats. It's a competition based on a singular goal of like they kind of do a lot of enriching of each other. So they're not. I don't know if they're real different opinions. They're just pretend-ish.
I don't know.
Does that make sense? Sorry to wrap.
Yeah. No, I hear what you're saying, but like I've heard like a lot. And a lot of people in the U.S. say this, like they don't think it's right for them to be paying for someone else's health.
I've heard those words.
I've heard those words too.
I've heard that in relations to universal education. I've heard that in relations to healthcare on many occasions. You know, which is something that in Brazil, like it's unheard of. Like in Brazil, like it doesn't matter how right wing you want to be. You don't play with the national healthcare system.
I agree. I think that's I hear that from people too. But most polls, Reuters polls, show that the ACA, which people have a problem with, and it's not single payer. I'm not trying to claim that it is.
Can you not?
60% of people believe in it.
What you're saying?
I'm sorry.
Yeah. What's that mean?
Remember, we have an international audience, so we don't want to.
Right.
Oh, I'm sorry. The Affordable Care Act, aka Obamacare.
Oh, okay.
The Reuters poll is it's a pretty good poll for like judging national sentiment. 60% of people believe in that. So the majority of people believe in that. And that's enough people to be able to push across a policy legislation. But we don't have representatives that are really always concerned with what most Americans think.
Yeah, but Obamacare, like in my opinion, Obamacare kind of like it doesn't. My problem with Obamacare is that, how can I put it? It doesn't actually push towards universal healthcare. Like it plays with the idea of insurance, right? And for example, in the state of Washington, right, they were actually having a problem with people who used Obamacare, and they were saying that people on Obamacare, they couldn't have access to dental treatment in Washington because no one takes it, and you can't force a dentist to. So in other words, you have health, your insurance, but it's worthless because no one, and that's what I'm saying, like it's different from like how we think of healthcare in Brazil. Healthcare is not insurance. Healthcare means that if you need help, you can walk into any place and you get what you need.
Well, like I said earlier, I was not saying that the ACA, the Affordable Care Act is. I'm sorry.
I'm going to give both of you an example, and I'm going to give an example for people who are listening of what they mean when they keep talking about universal health care. The first example I'll give was when I lived in Sydney, Australia. Out with friends on the street, there was a guy roasting meat. I have around roasted meat, I have the discipline of a street dog. So, of course, I asked for some. That wasn't the problem. He smeared this beautiful barbecue paste on it that had a lot of stuff that I was allergic to. So I'm eating it, and this lovely young woman I'm having a great time with, and I'm showing her how awesome and amazing I am. She said, "Stop." I stopped talking, and she looked into my eyes. Now, she's a professional nurse. And Maurice, you can testify that when someone goes into nurse mode, there is a sternness. It doesn't matter if it's a man or a woman. There is a sternness that they take on. And she grabbed my face with her hands and turned me to the side. And she said, "Sit right here. Don't move." She gets up, goes to the phone, calls an ambulance, uses some kind of a code. She said, "You're having an allergic reaction to something you ate." And she walks me to the hospital, to the ambulance. They take me to the hospital. The doctor comes in the room, fixes me up with an injection. Everything goes swimmingly, and at the end, I reach for my wallet to hand his assistant my insurance card. And she said, "What's that?" And I said, "It's my insurance card." And she couldn't catch what it meant. She calls the doctor. The doctor comes over, and she said, "He has this insurance card, but I'm not sure what we use it with." And the doctor looks at the card and says, "Oh, you know what? I've got a cousin in the States. In the States, you have to pay for medication." And she still, again, it's a foreign concept. Foreign concept. She says, "Well, what do you mean?" He said, "Well, yeah, if you go to the emergency room or you have an ambulance, you have to pay cash for it afterwards, or your credit card." And then she looks at me totally innocently and says, "But what if you're poor? What if you just don't have any money?" You just die.
Hopes and prayers.
Right.
And that's where it gets ugly.
Yes. And I don't think that most people really prefer that. I think that most politicians are okay with that for the money that they receive. A big impedance to the ACA, Affordable Care Act rollout, was that a lot of state senators, governors refused to accept government subsidies along partisan lines. And so that limited the ability of that coverage. And the single payer healthcare act from it was scrubbed. But we can look at like maybe the midterm elections and like the whole kind of blue wave thing, but people like that push Medicare for all and these like what we call progressives. I don't think that's really progressive, that people shouldn't die just because they don't have money, but whatever, being pedantic. Those groups are pushing policies that are pretty popular. Are they going to get through? Not necessarily, because we have lots of long-standing politicians that have large amounts of money from health insurance companies, drug manufacturers, and other groups that help them push this narrative. So I would say that I would say that the outrage and like strong feelings that people may think they have about these are frequently manufactured, because you sit somebody down and have that conversation wanted, and they don't have strong reasons why they feel that these things should work the way that they do.
Right.
Well, like, why do you why do we have a funding for medical stuff? No one thinks that should happen, but they have in their mind that these things are separate issues. It's like the way when people say that they're socially, they believe in social liberal ideas, but like financial conservatism. That's just stupid, because these things interact. And so often I think that people have a disconnect with how they understand it. I'm just saying, not saying that it doesn't exist, but that it's not
slow down. I do often identify as a fiscal conservative and a social liberal, because while they do interact, they are not necessarily one and the same.
They're not the same. Like getting sick and dying don't have to be like together, but both of them definitely have a strong relation. You can't say that you believe in children not starving to death, but you also don't believe in taxing people, and then you're surprised that these things happen at the same time. Like it's a pretty poor dichotomy.
Right.
Like you can't be totally for, not kids getting shot in schools, but also be like free gun rights. Like that's like all the gun rights of anything that somebody wants to get. You have to realize there's a connect between these things, right?
Right.
So I don't think that that's like I don't know if that's a real position. Either you believe that people should live and not die from basic things that be caught by preventative medication, and you're okay with funding those things, or you're not. It's a binary choice, no matter how complicated.
I refuse to accept that logical fallacy that you're trying to reductum ad absurdum to make it such a small issue that it becomes a binary choice. That is not a binary choice. There are nuances, and the lack of discussing the nuances are why we're here, and why so many people fall into these huge camps of you're either with us or you're against us. It's not a binary issue.
So what is your financial conservatism?
Financial conservatism does not necessarily mean I am against healthcare. It could mean I'm against the rapid expansion of government. Financial conservatism means, in my opinion, that when someone reaches a congressional or senatorial level, they are not guaranteed all the benefits of their station until the day they die. That's a big one. One of the reasons that they can talk about healthcare in a way that most people can't. Once you reach, one of the reasons that a lot of people don't know is that when you can reach a certain level in your state government or your federal government after that, all of your health care for yourself and your immediate family is paid for 100% for the rest of your life with the best health care possible. Yet these people are voting on what's going to happen next. I want him to feel that same after he leaves his job, just like anybody else. And we can talk about disengaging your health care from your job next, but I want them to feel the heat when he leaves his job of understanding if his grandma breaks her hip, if his wife has a lump on her breast, if he's got a lump on his testicle, that he's going to need that healthcare system to be there for him. But there is no pressure.
I don't think so. Your position is that politicians shouldn't get these healthcare subsidies.
My position is that fiscal conservatism can't be reduced to your idea that I'm only talking about no healthcare, because I'm not. I do advocate healthcare for all. I just gave you a story about how I use healthcare for all.
Right. Because in Brazil, you have a lot of like people, like I said, like who are very right wing, whatever. That when it comes on to healthcare, they definitely believe that healthcare should be for all. So I can see how somebody can be like, because when you said it's binary, like people think differently. Like for somebody, they think healthcare is a completely different conversation. Everything else, okay, we can be very conservative here, but here no. So I don't think, as Watt says, I have to agree with Watt. Like sometimes, both They don't have to be the same thing. You know?
I'm just not understanding in the specific realm of healthcare how you can be conservatively minded. Okay, maybe I'm speaking based on when I hear people in America in my like groups of people when they talk about the idea of financial conservatism, it does not match up to any way that makes things socially liberal and socially reasonable. And so that's the disconnect. I think that both of you guys, do you both live in Brazil?
Yeah, now I'm in Brazil.
I think that you guys experience a big left shift from what conservatism means to you and what conservatism is in America and what that system means. I have people that are like,
it's funny because
I think that's why we're missing each other.
It's funny because here in Brazil, we joke when it comes on to America. Like, for example, like what Americans consider left, like for us, it's like at most like 10 degrees from the center towards the right.
What we're talking about is that shift in the Overton window. When you cross borders, that Overton window, and by Overton window, there is a range of acceptability in any given subject. Now, you can go left or you can go right with it, but there is a top and a bottom to what people will accept. When you leave America, what people are willing to accept for the minimum standard of healthcare is above what most Americans will ever get with the best job they have. You know, I was shocked to find out that the pharmacies in most countries, but certainly here in Brazil, there are medicines that are considered extremely, you've got to get a prescription, it's got a black label, and it's going to cost a lot of money that you can just get over the counter everywhere else in the world. I was a kid with asthma, and to this day, I keep an inhaler in my bag because if I go to your party and you're smoking outside and I'm having a conversation with you, it may aggravate my lungs. So I'll keep a little inhaler. You know how much they cost here? I think it's like $5, which is like $2 in America.
Nothing. Right.
You just go in and say, I need an inhaler, and they just throw one to you across the pharmacy.
Right.
In America, children die of asthma attacks because their mom can't afford one.
Right. In Brazil, so in Brazil, a majority, we have what we call farmácia popular, right? And that basically means, in English, that would be like let's say a public pharmacy. Basically, it's a program where meds for diabetes, hypertension, asthma. There's another one I'm forgetting. You can get for free. Basically, it's like four medications that affect a majority. I wouldn't say a majority, but a large part.
You get it for free.
You can get it for free. You can get
that makes sense.
Now, what happens is that if I can pay for it, I wouldn't necessarily go to a farmácia popular, right? I would just go to the supermarket, the pharmacy, and just pay for it. But for somebody who needs it, they can get it for free. So yeah, I'm just putting that out there.
Okay, so going back to that, so let me go back to Watts. I totally understand what you mean now. I think that what I mean by conservatism in the United States is just a different brand than what you guys probably experience in Brazil. Here, people be like, I'm all about free market, but I also think that drugs should be cheap. You can't believe in both of those things here, and it'd be a reasonable thing. For instance, insulin costs are a great example of that. We don't have big kind of ways to rein in large companies, and like the cost of Humira, which is Humulin, which is a pretty regular insulin, is like in the last 5 years has gone from like maybe a $200 prescription, which is still crazy, to over $1,000. You can't believe that we should have a total free market system, which means corporations get away with everything, which is like most people when they talk about conservatism believe in, and also say that insulin and life-saving drugs should also be available to people.
No, but
those things are in
Brazil,
that makes sense, but in the United States, it doesn't.
But I think it doesn't make sense in America, not because it doesn't make sense. It's because, in my opinion, I think that Americans just don't want it to make sense. Because you can actually have that, right? You can actually have a system, right?
Corporations, American corporations don't want it to exist.
Right, there you go. Where healthcare can be viewed as something separate, right? Because as I said, it's a human right. As the moment where you see that healthcare is a human right, you don't treat it like a commodity. You don't treat it like everything else. So yeah, you can treat oil, you can treat gold as a commodity, cutthroat. But healthcare is not. That's not how we view it over here. And if America views it that way, you can maintain. America can maintain. At least people can maintain their conservatism, whatever, and still have a working healthcare system. So I don't think it has to be the same.
The right here, unfortunately, that's like just not a tenet that's being pushed by the American government. So I think that I think we talk about conservatism in my view versus your guys' view. We're talking like totally different beasts. Because here we don't. It's like we're still in like the debate phase of, is healthcare a right? It's like saying, should people be able to live? That's what we're at right now. So you have to understand, I guess that's what I thought you meant when you were talking about conservatism. So I can totally understand how that's a valid view in that political realm. But here it's just, it doesn't make any sense because the way things are just kind of ridiculous.
But I think even on the large scale, I don't think in America, the right conversation is being had. I think the only person that, the only person that I saw really having the right conversation was Bernie Sanders, right? What he was saying in Brazil, that would have been like, oh yeah, that makes sense. Yeah, let's vote for that guy.
Clearly,
because he's like, oh, healthcare, education, okay, that makes sense out here.
Alexandria Cortez, also recently elected, pushes those ideas. So I feel that we are seeing maybe changing to that, but it's still in the debate form. In Brazil, it's settled. You guys are settled.
But what I'm saying is that, in my opinion, America pushes more universal insurance coverage and not universal health.
I agree.
Do you understand what I'm saying? There's a huge difference. There's a sense of when an American says, I have insurance, there's a sense of wow, I feel safe.
You know what? That's actually a huge
because in America, your insurance company, this is another thing that really shocked me, because I think in America, insurance is the only industry where you pay for something and the person can say, no, you won't get it. No. Because here in Brazil, if you pay insurance and and the insurance company says, listen, we cover this, it doesn't matter how many times you need it. The government makes sure, and that's I guess that's one of the reasons why you said earlier that in other countries, the government is the intermediate between corporate and the patient. And it's very true. And that's one of the reasons why a lot of patients here are protected, because the government made sure that, listen, I don't go into a store and buy a pair of sneakers and you tell me I can't get my sneakers. I just bought it. Insurance should be treated the same way. And I know people who have used their insurance with insurance companies trying to kick them off of the plan. Get rid of them just because they're using their insurance, something that they paid for.
Well, earlier you said something, and I want to tap into that. You said that Americans would make this phrase that you would hear saying, I've got insurance. In the United States, that's a marker of a job that pays you and takes care of you. Whereas outside America, people look at you and they go, why is he so happy about having insurance for his health? Well, you don't understand that for a lot of Americans, see, this is the other issue I want to tap into. In America, your health insurance, healthcare, however you define it, is directly tied to your working for someone else. And the effect that has, one of the things that, how would I put it? One of the things that I've learned is that there are so many Americans who go abroad and do well, because when you remove the burden of, I've got a chronic disease, or I'm just a healthy guy who wants to get a checkup, and I no longer have to look at that as a back-breaking financial issue, you can focus on a business, and it really changes things.
I don't know. We've had this conversation for a while. I don't think it's that simple, but okay, whatever.
It helps. One of the big legislations being pushed right now. Oh, sorry, go. What? I was going to say one of the big legislations being pushed right now by Brian Kemp out of Georgia. His big plan to save money for insurance costs is to kick off high-risk users.
Wow.
And people are like, this is going to help bring down insurance premiums, when he could also just use some of those government subsidies or use other available systems or push a single-payer healthcare system. But instead, he's like, let's get rid of the people that need health insurance the most so we can bring down costs. That's an American solution to it.
Or get it from your defense budget.
Right. That's conservative.
Get it from your just take some money from the army, that massive American defense budget, and you guys can afford a universal healthcare system. Like Brazil does it. A lot of
We
countries,
can afford universal
Jamaica.
healthcare.
Jamaica is poor, like poor, you know, and we have one. It doesn't work as well as Brazil, but I mean, at least we have one, you know.
We're dead last as far as developed nations for health insurance, for health care outcomes because of
Right,
systems
right.
like that are not in place. And we don't even have to take money from the government. We could take money from the corporate entitlements we pay, and we could have enough. We could stop paying Walmart money from the government, and that would be $6 million. We could stop paying Apple, which is half of our nation's GDP,
What?
from taxpayer money. We still pay into these corporate, we subsidize corporations, and we could easily have enough money for affordable healthcare options or a single payer system. But corporations have so stacked the government and people that are proponents of their ridiculous system that those things are not coming to fruition. So we don't even have to you don't even have to cut the military. That's a big problem, but we don't even have to cut it. We can just stop paying Walmart. We can stop paying Walmart to underpay their employees so they have to take extra additional government benefits and then giving them tax breaks. So
It's kind of, what do you think about this point, Mo? Because I find that when people actually, especially in America, when people actually care about a topic, they will protest. They will make a big fuss about it, and that's everywhere. I'm saying, like, if it's that big of a deal, if the American population actually feels as though that's a big deal, you know, I think more voices from the population would be heard. Whereas, for example, like let's say in Brazil, like if somebody touches our national healthcare system, like, man, like I can't imagine what would happen. Or if someone decided to like cut because also in Brazil we have universal education is also a human right as well, which basically means that even though I'm not Brazilian by birth, right, I have the same rights as any Brazilian as long as I'm studying at a government school, right? So I don't pay tuition, or I didn't pay tuition, right? So
do you even know what tuition is anymore?
No, I don't even know what tuition is.
I'm jealous.
Yeah. So, you know, it's like I can't fathom the government touching any of these systems and Brazil being like, oh, okay, yeah, sure, no problem. Like people take to the streets, and I've seen America do that on many occasions, take to the streets. But for some reason, I don't feel as though healthcare is, even though it's important, but I don't feel as though the average American, it's at the top of his priority to really make sure his government puts that in place. I don't know if you agree or not.
I agree in some ways. I think that we also have other means and systems of complacency that don't exist in the same ways that they exist in other countries. One of them is the amount of debt that Americans carry is higher than most other developed countries. And we can purchase things through access to credit. Putting those things off allows people to feel a little bit better about it. Furthermore, the reason that America scores really low in healthcare in healthcare outcomes throughout the world is not always because of like the middle-ish group of people that has jobs that have like political capital and those kind of things. It's because the lower sector of people that literally are working so that they don't die and starve to death tomorrow don't have time to go out and do a protest necessarily. And America has a really good skill set.
And give a literal example. When we talk about Walmart, you've both been in Walmarts. I didn't know this until, well into my adulthood. When you see the elderly greeter that hands you that little flyer that tells you what soap is on sale and where to get your chicken, those older people would be able to retire, who even are financially solvent and have enough to retire, still can't afford all the medications you need at that age, and they have to take a job just to get health care. So they're out there with money in the bank to retire, but they've got to make $8 an hour handing out flyers to guys like me who just walk right past them, because if they don't, they can't get the diabetes, heart medication, fill in the blank.
I know a lot of them. I know medicine. Yeah, I know a lot of them because, a lot of it's funny because based on my time in America and what I know is like a lot of the problems that Americans worry about, like for us, it's like, really? You know, it's really shocking because I remember. So I studied at the University of Sao Paulo, right? And one of the documentaries that we play, because we have a course called social medicine. So everyone who studies anything in the medical field, we take that course because we study within the or medical schools, right? It's a part of the national healthcare system. So all through dental school, I was treating people within our national healthcare system. So we're all, do you understand?
Yes.
The school is integrated with the national healthcare system. Okay.
Yeah, we don't have that here.
Right. No. In America,
It's
you don't
not a
have that.
thing.
No,
No,
it's
we
not.
don't even have like we talk about altruism in our classes frequently, but at the same time, you can find people that would be talking about how much we need to help people and these social progressive ideals, but then we'll vote for someone like Brian Kemp, which pushed the legislation I talked about earlier of kicking people off the healthcare, which is why I was talking about like incongruency between like social liberalism and like financial conservatism is not a real thing here. I just want to go back a little bit though, real quick. I think another power that media and things like that and like large groups and politicians have, people with political capital in America, is to define who Americans are. And look at who people that will want to protest things that are obvious and reasonable and should be changed. And you can call them communists. When the Black Panthers protested things like sickle cell disease, that's a problem. They're Black Panthers and they're these scary Black people, not real American ideals. So there are protests and things like that happening, but they're always put as outsider groups. And I think that, and every time that America finds another group that kind of agrees with that idea, they kind of conglomerate them into this ideal of being American, which is the same thing as being white, because whiteness is not even a nationality. But we kind of put these groups together, and a lot of the groups that are being hurt by horrible healthcare are minorities.
Right, but that, in my opinion, is one of the biggest problems because like I said, there is no way I'm going to pay for your taxes. I'm going to pay for your healthcare. I'm going to pay for universal education if I don't feel as though we have something in common.
Yeah.
If I don't feel as though you are just as Brazilian as I am, just as American as I am, we don't have that connection, and like I said, tragedy tends to do that because I won't lie, like in America, and I always ask my American friends this: the most I've ever seen Americans come together is after something tragic. Well, after something really bad happens, everyone's like singing "Kumbaya." Everyone's like, "We need to come together."
There were about 2 months after September 11th where Black people were Americans.
Yeah, everybody was Americans,
but at the expense of Muslim Americans who are now seen as other. They're interchangeable as to what that group means. And when you guys say that you're Brazilians, if you ask me what I am, I'm a Black American. Black comes before the American part because that's how we've been treated here, and that's the group that we identify with. I don't identify with like mainstream America, but I have the attractments of it. I'm a professional with degrees. I own a house. I have those things that would make me like what you would think would be the normal American, but I still identify as a Black American. And so I think Americans are okay with paying for things for Americans.
That's what I'm saying.
Black Americans sometimes, and not super like socialist Americans or socialists or whatever group they decide to identify them to make them separate than Americans.
But I think so.
Corporations play on that.
Yeah, because I think we're saying the same thing.
I think we are
to some extent because what I'm saying, I'm making it very clear. What I'm saying is that unless people see each other as I won't say equal because that's not true, but
kinship. If they don't see a kinship.
Yes, kinship. Right. If you don't see a kinship,
equity, not equality. Equity. I believe in equity.
Right. If you don't see a kinship, when you look and see someone else suffering, and you say that is my American suffering, that's my Jamaican suffering, that's my Brazilian suffering. If that's not there, universal healthcare, it won't happen because you have to convince the population that even though I don't have cancer, I'm gonna pay the bill for that person over there that has cancer, even though I'm a healthy American. I've never been to the doctor. I've never needed it, but my taxpayer dollars have to pay for that guy who chooses to eat badly, that guy that chooses not to work out. Do you understand what I'm saying?
Yes, and that's the power of how labels change things.
Can we dig into something that I thought about as recently as last night that just made the list of things I wanted to discuss with you? When you said, I have to pay for that guy who doesn't work out. All three of us engage in serious physical activity. All three of us enjoy, we'll call above average, physical pursuits 3 or 4 days a week when we can. I was at a samba practice last night as they prepare for Carnival. And I tell all my friends, the best time to come to Brazil is during the 8 weeks before Carnival, because you can see these amazing shows without the drunk people on the road.
Right.
At the school I went to, there was all the groups of women that are even in the same school. You have different groups of women for different dances. Some wear the Tina Turner when they spin around, it frills and they dance. Some wear the long, flowing, very old-fashioned, South American dresses. But there was one group, they were wearing mini skirts, purple shirts with white lettering because their school is I think the school colors are blue and white. So there was a deep blue and white. But I noticed something immediately that separated these women from all the rest. They were all obese women. And when one of them turned around, the actual lettering on the back was called the Plus Charm. And a young woman in the organization had a conversation with me about it. And I said, that seems, I don't know how I feel about that, because while I don't care, I do care. And I'm going to tell you about my little bit of confusion. One, I'm against obesity. I grew up watching obesity kill people that I love. I know obesity does not care if you are body positive. Type 2 diabetes doesn't care if you got a lot of Facebook's likes on you're a bear or you're a curvy girl. When that stroke finally hits you, it's not going to really give a damn about how you were finally able to find flattering clothes in your size. Obesity will kill you. At the same time, sure, you should be able to do what you want. So my issue here is twofold. One, she told me that a lot of the other women felt as if it was unfair that they created an entire dance troupe just for the women that were, these women were, in the US, we would say, let's say she's 5'8", 250, not muscle. In the UK, in other countries, not just UK and South America, let's say she's 1.7 meters and
100 kilos.
And 70 to 80 kilos of
250.
Huh? Yeah. And
250 is half.
You saw them, you immediately understood they were in their own category. And the other women who got where they were, because you have to earn your spot in the dance troupe. It's no different from being in a Janet Jackson video. You got to earn your spot to dance over years of practice and being beautiful and smiling. And these women were clearly not going to make the cut. And she told me there were only about 8 women in this division, but they said that a lot of them really felt, wait a minute, we're going to spend money on their uniforms, give them time in front of the crowds when they clearly can't make the cut to be a dancer with our school. But at the same time, do you give them protected group status? Because you can't pick on someone because they're Jewish or Christian or Muslim. You can't pick on someone because they're gay or bisexual or transgender. Is being fat the last area where it's okay to pick on someone? And B, how does that affect our healthcare system? Do we look at obesity as an illness? Because it's difficult to be in a country where I would definitely say vanity is a plus here. In the United States, I'm one of the oldest men in the gym. Here, not even close. There's a guy I work out at the gym. He's got all white hair, and this guy does unassisted behind the neck chin-ups for repetitions. And I'm just in awe of this man. To see a woman that large in America is totally common. Americans are fat. To see it here, they stand out in a way that others don't.
Right.
I want you to, Andre, you've been here longest in Brazil. What are your thoughts?
Repeat the question on what? What exactly?
Do you believe that the obesity should be something that is addressed by the healthcare industry? And do you believe that,
the industry or the healthcare industry or the national healthcare system?
The national healthcare system.
Right. Okay.
And I understand that everyone needs healthcare, but is there a personal responsibility to not become unhealthy in the first place?
Listen. Well, first of all, obesity is new to Brazil, to be quite honest, because Brazilians, if you talk to somebody who's maybe 80, You know, that you didn't really see fat people in Brazil back in those times.
Yeah, the
you know, because,
gordophobia. That's
yeah,
the word.
yeah,
Gordophobia. For fat people.
right, yeah, for fat people. But I'm saying like back in like what, say the 70s or whatever, you didn't have so many corporations like McDonald's and Burger King, and you know, Brazilians didn't eat a lot of pizza. We did not eat. Brazilians did not eat. How can I put it? Like the American. Let's put it that way. So obesity is relatively new. So basically, our national healthcare system is basically playing catch up, right? Obesity is a problem. Obesity is a disease. Now, it doesn't mean that every fat person is obese, right? And I think a lot of people like mix the two, right? I do think that Brazil, in Brazil, what you find a lot of like public gyms. I actually work out at a public gym, right? And that's one of the initiatives that the Ministry of Health and the Ministry of Sports they have pushed, right? So we have public gyms all over.
Well, I've been
So
to
yeah,
one.
I do.
I've been to one.
Yeah,
what's a public gym?
It's a
I'm kidding.
It's a,
You just don't. I know what
oh,
you mean,
okay.
but you just don't have it.
Right, right. And that's
not
really,
a
and it's very funny because it goes back to what was saying. What is healthcare? You know, because here in Brazil, healthcare, like going to the gym, is part of what a healthy human being does. You know, and the government pays for that. That goes under. That's part of the national healthcare system. If you Google SUS, that's our system, Sistema Único de Saúde, and you'll see like there's so much legislation that covers healthcare in Brazil. So many, and physical education and going to the gym is one of them. You'll find a lot of even in poor neighborhoods, a lot of like state sponsored football. You guys say soccer fields. You know, because people play soccer here a lot. You won't find basketball courts as much, but you do have it as well. You know, so I do think Brazil really pushes for that because at the end of the day, you know, unhealthy people is are a burden, I guess, on the healthcare system. I don't think that Brazil does when it comes on surgery. I personally know people who got their stomach reduction, not stomach reduction, the gastric bypass. That's what it's called.
Yeah.
Right, or the balloon, or the balloon through the national healthcare system. You know, I personally know people. They didn't pay for anything. Right. So I do think Brazil does a good job when it comes on to like dealing with that. Yeah.
Okay. I think that one thing that we have to look at too, foremost, is that obesity in Brazil. I can't speak to it. I've been to Brazil like once, Foz do Iguaçu, but I can't speak to like what's about your society creates problems with obesity. But in the United States, and specifically because I work with the Indian Health Services, I see that large amounts of those people are obese. And then I've also been to a reservation and done healthcare there. And the problem is that people live in food deserts and they don't have sound and solid choices or means and ways to get good food. Right. So from my perspective, how I feel about people being overweight, realizing what that can do to them, I think that biology pushes on those groups of people enough. Like, there's nothing I can say or make someone feel worse than getting diabetes type 2. So I don't even really believe in like trying to fat shaming or being anti against that. I've like almost if it was some like a religious thing, hate the fat, not the overweight person, would be like how I view it.
Right.
And realizing what that means. And often, like, we don't even, like, it's a revolutionary idea. Like here, the idea that we should focus primary prevention on also people eating healthy. And we just don't do that enough or have those kinds of means and ways to make sure that happens. So in the United States, I feel that the overweight and obese epidemic problems are problems of poverty and poor choices, poor geolocation for people that have no choice on where they're born and where they grow up, that live in areas where they have no economic options and fewer food source options. So I can't say anything negative about those people because I just happen to be lucky enough to grow up with a moderate level of influence that gave me more options on what I could eat and what I'd have time in my day being able to do.
It's funny that you said that because so here in Brazil you do have a lot of poor people, you know, but at the same time actual food is cheap.
Yeah.
You know, whereas in America I find like let's put it this way: the average poor person in Brazil can't afford to have McDonald's every day. Like they'll probably go to McDonald's like maybe once a month, you know, because out here McDonald's is like one of those things you take your family to the mall, you probably have some McDonald's or whatever. Whereas in America, yeah, I'm right? What?
Yeah.
Whereas in America, like you can literally, I've had burgers literally for $1. I've had burgers for 75 cents.
Well, the
To the
dollar
point where I'm like, to the point, no, I've had burgers for 75 cents. I was like, is this actual meat? So you can imagine, like, someone who doesn't have any money, right? He has $10 in his pocket. That's what? 10 burgers? 12 burgers? That's breakfast, lunch, and dinner.
Or a head of lettuce.
Right. You know?
Like, which one are you going to choose?
Right. The quantity or the quality.
Okay,
you
so,
know? So
if we understand about Brazil, where do you get all the people like that specific group popping up where you're dealing with people that are so big that they have to have their own category created? Because to be clear, these young women could not, under any circumstance, be part of the regular dance.
I know. I think that's different. No, I think with that school, because Brazil does have I think Brazil, the standard of beauty in Brazil is very, very high and very rigid. It's very rigid. Like, you know, I'm not saying that in Brazil, like if a fat person goes to the beach, people are going to look and be like, ha, 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 you're fat. No, you're going to wear your stuff on the beach, but you will not be considered beautiful. Do you understand what I'm saying? Does it make sense?
I don't think it's hugely different in the United States. It's just that most people.
But what I'm saying is that what's considered beautiful in Brazil is very strict. Like when it comes on to what a beautiful body looks like,
right.
And a lot of Brazilians, Brazilians are way more vain than Americans. Take it from me, way more vain. And people take a.
Before you, I was going to say, Mo, before you jump in, I want to tell you, after years of living here, I can tell you that you don't realize how accepting we are of savage obesity in America until you're not there anymore. Until you spend abroad. I mean, you really don't understand. Now, no, that's the wrong word. As I grew up, and even in my young adulthood, I saw the ravages of obesity on people that I knew and loved. So that was the thing that got me, was fear. But then living abroad, I mean, you just realize most people throughout the world, and not just in Brazil, which they enjoy vanity to a new level, it's just not the case. You just don't see it. You just don't.
Yeah,
situation.
Like in Brazil, people are actively trying to look slim. Whereas in America, like you can be fat. Okay, it's not good, blah blah blah. But you can.
It's socially normal.
Be fat. It's socially normal. It's hard to explain it.
Yeah, it's socially normal.
It's
socially normal here, but the reason that it's socially normal here is because we have large corporations and companies, if this hasn't been a theme for my entire talk, that subsidize the cost of unhealthy food substances for people to purchase at low amounts. A burger does not cost $1. A subsidized burger that's subsidized by American taxpayer money to McDonald's and other corporations to provide that food does cost $1. And so anytime that something becomes endemic to a place, it does loosen the norms of how people feel about it. So like most people, 33%, I think it was, about a third of Americans are overweight, and a third of those people are obese. That's endemic to the United States. It has to become a part of the beauty standard because every single if 1/3 of the people, that's someone in your family. You can't say half of the third of your family ugly. So while we're accepting because it's a problem that's endemic to here that is caused by unique circumstances that are different than maybe say culture, but are more pushed by our capitalist ideals of what corporations can influence people's diet.
But let me finish my point. Let me just finish.
Hold on, one second. Let me play the race card. Out of that 33%, do you think a disproportionately large amount of that number is made up by people who are brown like us?
Yeah, because they're poor.
They're poor. Yeah.
And it's done by institutional racism. Like, it's not a surprising accident if you treat people like horrible for hundreds of years and make them slaves for longer than they were citizens, shockingly, they're probably going to have less resources.
Right.
Andre,
Getting back to the point, I'm just saying that here in Brazil, different from like in America and in Jamaica, you won't find somebody who is chubby on TV. You won't find somebody who is chubby, in a place that people can't. You won't find a chubby person in the front as a receptionist. It's very hard. You won't find a chubby person, and being seen. I'm not even talking about a fat person or an obese person. I'm talking about like a chubby person. So I do think that there is a line between being obese, and being chubby or being fat. Like it's not necessarily the same thing. Because I'm from Jamaica, and I know a lot of chubby people, who've lived, longer than maybe I will ever live. But they're actually big people, but they're not obese. I don't know if that makes any sense.
But I also think part of it is what I like.
So I do applaud the Samba School, for giving them that space to show that, listen, Samba represents Brazil, and a majority of Brazilian women don't look like the girls on TV. They look great. Don't get me wrong. Brazilian girls look great. But they don't look like those girls.
Obese. The majority of them may look like just an average woman.
Yeah, but they don't look like those Samba chicks, though. They don't look like those Samba chicks.
Right.
They don't. So giving them opportunity.
Body mass, you're not going to find that many overweight, obese women just walking down the street. Now, I will tell you this. This is something, I don't know if it's the law of unintended consequences or if people said yes without thinking. I saw during the dance when all the different women and men would dance and do their routines, and when they could go in and just freestyle in their dance, it was no contest. It was slightly embarrassing because those women could not. There was no. That would be like me getting into the ring with a professional heavyweight. That's like me with Cain Velasquez getting into the ring and expecting that I have a chance. It just doesn't.
Think that? Yeah, and I wouldn't, and we shouldn't clap for that. When I think about obesity here, it's a different epidemic than it's a different problem than what you're talking about in Brazil. It seems like in Brazil, you guys do have more
It's not
choice.
that bad. It's not as bad.
In the United States, it's less of a choice and more of just a chance of birth and random bad luck for basically being born in that place or being born of a group of people that have less things. In Brazil, it seems like it's more of a choice.
I agree because assuming I agree.
I'll be right back. I've got to go fail a urine test. I'll be right back.
Right. I'd agree. I agree with you because here in Brazil, like eating like American food, American style food is shows, how can I put it, financial success to some extent. So like you'll take your kid, which is strange, because you'll take your kid to McDonald's. You'll take your family to McDonald's. You'll take your family to KFC. You'll take your family, and that's considered like a family outing. In Jamaica, it's the same thing. So like in third world countries, right, eating like an American is it's recreational.
It's a luxury success.
Right. That's good. Right. Love the word.
It's the same
luxury.
thing in lots of other developed countries too. Like
right. Exactly.
In Japan, KFC is a Christmas, it's a Thanksgiving tradition, or I don't remember if it's a Christmas or a Thanksgiving tradition, but it's not a daily thing.
Friday. In Jamaica, Friday is KFC Day in Jamaica.
Yeah,
like
it's
everyone goes right. Like
and
people don't.
And it shows that. It shows that like by the fact that people there are not obese. Here, it's almost a necessity that you might have to supplement some of your decent eating with unhealthy food because you can't pay money to the end of the month. You have at the end of the month, you have $50 to feed a family. You can do that in McDonald's, but you're not going to be able to do that with salad. You can't do that in any other way. So it's less of a choice here. So
I was
going to say, so like when I look at Watt's example, for that thing, I don't think that there's a reason to celebrate mediocrity because it seems like you do have more choices there based on what I'm hearing. But here,
but I don't think
acceptance should be pushed because those people don't necessarily have choices on what they can get. And so on that sense,
that
acceptance.
But what I'm saying is that in Brazil, for example, I can speak about my ex-girlfriend, right? My ex-girlfriend was fat, and she was highly qualified, and they would religiously. She was a black girl, chubby girl, afro, and they would talk to her on the phone, because different in America, you don't have what you call a black accent, so you can't tell the race of the person over the phone. And when she would go to these interviews,
that's a different conversation we're going to have. That the concept of talking black doesn't exist in Brazil. You can hear someone on the phone and you have no idea.
It doesn't exist anywhere else. I've never heard this. This is like an American Canadian thing. Like I've never for me it's crazy. But anyways,
it's racist.
So yeah. Anyways,
all racism is crazy. That's what it is. It's weird because it shouldn't exist, but it does.
Yes, it's super weird. But anyways, so she would religiously go to these interviews, be like, listen, you have a job. But when they would see her, she would not get the job. And in Brazil, in America, like a fat lawyer can get a job. In Brazil, especially when it comes on a woman, like a fat guy, a chubby guy, he has a better chance of getting a job than a fat girl.
Well,
so
it's
no, but it's different. It's very different. It's very different. I see a lot of fat people working in America. Right. You see them. In Brazil, you don't see the fat people.
There's just a lot less of them.
Right. They're in the back room. Right. In America, you'll see them, and for a lot of her firms, So I do think that one of the problems in Brazil is that Brazil is a very vain country, right? And I'm not saying there's something necessarily wrong with that. I actually like that, but there are times where that vainness excludes people because a lot of people won't ever be a part of what beautiful looks like in society, and I don't think they just because they're chubby or whatever. They can't enjoy samba just as much as a girl who isn't, or get a job, or do you understand what I'm saying?
I think that's a false dichotomy. I don't think you can say that that's reasonable because realistically, anything that's a performance is based off of also how much the audience enjoys it as well. And if it's a visual representation of something that you want to share as an art form, you should just be like, I should be allowed to do this thing because I want to be able to do it. Well, we don't have to. Some people may not want to watch that. I'm not saying that I believe that. I'm just saying that that's like a big part behind it. So
no, but
I believe in acceptance of jobs. But if you're going to try and do samba, you can do samba at any size. I think that that's fine. But at the same time,
you can't. Right?
Like, well, we need to show up and support this when it's not. It seems like being overweight there is more of a choice. And if you do something for a performance that makes you more mediocre at it, why should people feel the need to strongly support that? I don't think because someone's fat they samba less or they samba. Well, the way Watt was explaining it, he just explained it as if they were not up to the level of dance.
I've seen chubby girls samba.
Let's not listen. I'm all for being kind, but let's not be self-delusional. These 250 to 300-pound girls were not any surface as well as a woman of appropriate height and weight. We can pretend all day. Listen, what I said wasn't nice.
They're big boned, Watt. They're big boned. They're big boned.
Right.
Here's the thing, and I say this all the time because I get emails and letters from men asking, how did you become successful? How did you start a global editing company? How did you do that? I tell them, listen. I'm just a kid who wet the bed till he was 15 and was the fat kid that everybody beat up. But I decided, you know what, this life isn't for me. And I decided to become the man I chose to be as opposed to the man I should have grown up to become. And that's
Do you deserve a participation trophy for just showing up? I say no.
Exactly. So when you say these girls can samba, they can enjoy samba. But for you to sit there with a straight
samba, it's not a competition. It's
a performance.
It's not the 100 meter. It's not the 100-meter dash.
I agree.
It's not the NBA.
I agree.
But if people overweight showed up to a
100-meter
dash, should they have their own team and be celebrated as if they were on the same level of people that came ready to run a 100-meter dash?
Like that's
Usain Bolt? No.
But that's different because Samba
competition is all about watching a performance you want to see.
Right.
It's exciting, right? And if you don't want to see that,
there's a reason there aren't many fat strippers too.
I mean, shit. Like, you got people who like fat strippers.
It's not a contest, but the stunning and overwhelming majority of people are looking for that when they're looking at a woman who's going to represent the Samba school. You know, and as someone, listen, I've dated women short, tall. I like fat chicks. It doesn't bother me one bit. But I'm not so self-delusional as to believe that the stunning and overwhelming majority are going to believe that same thing. So I understand when the young woman who's a friend of mine said that a lot of women in the organization felt slightly more emotional than normal about how do they get a spot on the team when clearly they're not going to be able to keep up with this. Are you going to put them in a separate parade now? Because remember, when they're all marching together and every section is doing different dances, this group of girls is going to look really bad. Because when you're surrounded by a bunch of different women doing their dances at normal Samba speed, and by the way, for people who don't know, Samba isn't just the dance, it's the length of time. I had to learn to appreciate that these young women are dancing at high level and high speed for an hour at a time. I've been backstage when after women who have been
it's crazy.
There's a man who will literally, when she comes behind stage, pick her up off the ground, and her friends take her shoes off, because to dance for an hour in the hot sun at high speed while you're smiling, that's got to be probably one of the most
So you're right.
These women are going to equal that. That's just
but what? Listen, like, I don't know which section you're talking about, so I can't really talk about it with much detail. But I would say, are you sure? Are they the girls that are there to Samba, or are they the girls that are there to parade?
Your connection's breaking up. I can't
have the Samba girls. What were they? It must be the fan. It's hot. Right. I'm saying, what was their position?
Oh, well, here's the thing.
Were they the girls that were, because you have different roles, right?
Who the best? Yeah, I understand they have different roles.
Right.
To my knowledge, they were being, and I could be wrong. Please do the research and correct me. I fully accept it if I'm wrong.
Right. I don't think.
To me, by the woman in the organization, they were going to be afforded a place to dance.
Okay. All right. Cool. But yeah. Anyways,
correct me.
Well, okay.
You're standing on this. You're standing on this soapbox saying that no, they're like everyone else. That's the shit that got us into a problem in the first place. That everybody gets a trophy for showing up. We are not all equal, and the world is not a fair place.
No, but what? I'm not saying that. I'm not saying that. But I'm saying that in Brazil, like, Brazil isn't like in America where they are considered normal. Like, these people, in Brazil, you're dealing with a different problem. You're dealing with a problem where these ladies, literally, a large amount of times, they can't get a job.
I'm not looking to employ them.
They're literally treated. They're literally, like I said, it may be hard for you to understand, but they're literally treated. They're literally treated as if they have no right. They have no right to be
in the game where you're trying to slowly migrate the issue away from a physical activity that requires a high level of physical acumen to them not getting a job.
But what I'm saying,
and no one is pushing that.
I'm trying to explain the logic. I'm trying to explain the logic why a Samba school would do that. What? Because guess what? Because guess what? There was a point where we as Black people, we weren't viewed as, the attractive people. There was a point.
The difference between being overweight
there was a point where we were never on TV.
Andre,
we were never on TV.
Let Maurice have his. Go ahead.
Okay. If we had the same exact Samba conversation about people in the United States, my view would change, because I don't feel that being overweight in the United States is as much a choice as you guys seem to say that it is in Brazil, if I'm getting your point.
You have more. You have more options. I won't say you have more options.
So these are just people. These could be so we can substitute the idea of them being overweight and you can put in the word, they are not good dancers. And those are the exact same things in this context. Should we celebrate people that come to a dance competition not as good as other dancers for their own choices and reasons? No. And is that the same thing as not hiring somebody for a job? No. And is it the same thing as being born black, which you cannot change? No. No one is saying that people that are overweight in Brazil shouldn't get jobs. And if you push that point, you're trying to say that we believe that equity isn't deserved by people for being overweight, which no one here is at all pushing. I just think that if you need to it's celebrating mediocrity, if people have a choice to be better at something, but are not based on those physical characteristics, which it seems they have choices to change.
Let me also do this with you, Andre. You and I routinely lift heavy weights. Is that a fair statement?
Okay.
Do we accept that that choice in life affords us a disproportionately high amount of attention from women?
I mean, I guess. I mean,
no.
Okay.
No. Let's be clear, and I'm being
Okay.
specific. Does the fact that you and I routinely lift heavy weights afford us a disproportionately high amount of attention from women?
I mean, it's a plus, but I mean, a fat guy in a Mercedes will attract more girls than I do.
We are not playing the deflection game. I want to hear you say the words, yes, I agree. And if you don't agree, I'll give you a different example. Do you agree lifting heavy weights routinely gives us a disproportionate amount of attention from women?
I believe I don't think it's the weights, it's the results. So I do believe that
the
fact that I look athletic. So the fact that I look athletic, I look different from the average guy. Yes, I look different from the average guy. So yes, I do get a bit more attention. Yes.
Okay, so you could have said that before, but you were hoping I would just drop it, which you know me well enough that that's not going to happen. So two,
right?
If we were treated the way other men were treated, why would we lift the weight in the first place? The obvious,
because it's healthy.
The obvious thing that we won't discuss is that every woman in this country has the option of eating 2 ice cream cones and 2 hamburgers, yet the majority of them don't. So we have to acknowledge that our
in which country? Are you in America or Brazil? Brazil.
Yeah.
Oh, okay.
All the women could be fat if they chose to be, but they understand that we understand that everyone's decisions directly impact how they are perceived. I am not telling you any nonsense about who should be treated as a human being and who shouldn't. What I am telling you is if the me that I should have grown up to become went to a gym and said, I want to become part of the competition fight team and go to the tournament with you guys and represent my weight class, they would beat me unconscious and drag me out into the alley, and I would deserve it because that's just a stupid ass. What they do say is, you know what, if you can make weight and in the gym demonstrate to us your ability to at the very least be competent for your age and division, yes, you can come and you can wear your patch. You know, I've trained with jiu-jitsu academies where you don't get to wear the competition patch unless the coach decides you can go compete and wear their patch, which are the best in the world. So for you to say that they should be treated the same as women who have made the objective and overt decision to exercise more, eat less, so that they can perform at a high level is nonsense.
But okay, so let me. All right. So first of all, in Brazil, and this is like I said, this is something that's new. Even though Brazil, the idea of obesity is new to Brazil, what we're finding is that you don't only put on weight necessarily from eating at Burger King or KFC. There's a lot of like natural Brazilian foods that are consumed here, right, of low quality as well, and that will make you put on weight.
Okay, okay.
You know, there's a lot like poor, and you can even see it because a lot of poor people in Brazil, they eat a lot of cornstarch. They eat a lot of carbs because they can't actually afford meat. Right. So even though you do have more choices, it's not a person with more money. They have the time to hit the gym. I have the luxury of hitting the gym. I don't have kids. I don't have a family to take care of. You know, someone who lives in a favela, they don't. You know, so you have a lot of these people that they honestly they can't do what we do.
Right,
you know?
I agree.
But
you're telling me that they can also that the stunning and overwhelming majority are making a huge sacrifice by not being fat, and those who do choose to express lack of discipline should not be in any way socially penalized for it.
No, I don't think anybody like what that's like me saying like, okay, so that okay, so let's say I got a scar in my face, right?
Right.
Like I do have the option of like saving all my money and getting plastic surgery.
Okay.
Right. But until then, what? I should be treated unfairly just because I'm not viewed as being beautiful?
In a beauty contest?
What?
In a beauty contest?
Not in a no,
Then
not
you're
in
not
a
gonna win
no,
it. You're
no,
not gonna
not
win
in
it.
no, not
Should
in
you
a
not
beauty
get a
contest.
job?
No, wait.
Absolutely not.
I'm
But
not
should
no,
you win
I'm
a beauty
not I'm not saying to
contest?
be no, but what I'm saying is that in Brazil, like these women, they don't have a chance to be on TV. They don't have a chance to get jobs
I
sometimes.
agree with you.
Like you said
TV
what?
is about entertainment, and it's not a real depiction of the
It's
real
also
world.
about, it's
Otherwise,
also
you just
about representation. You have a lot of chubby people. All right, you know what? Fine, whatever. Let's agree to disagree.
I'm not trying to make you mad, but I'm just saying you can.
No, I'm not mad. No, I'm not mad. I'm not mad. I'm not mad.
I'm trying to talk about like the idea of having equity between being able to eat, and you're saying that's the same thing as being able to be featured on a beauty contest when you're not beautiful. I'm sorry, but like some of those things are set up unfairly.
Dear brother, my dear brother Andre, what I think I have to say to really put a capstone on this to make sure you understand what I'm thinking, and Mo, you can agree or disagree. I believe that everyone, for academic, educational, and non-binary choices like are you qualified for the job or not, should be evaluated specifically on the content of their brain. But I also live in the real world where I understand that the fact that you should not be able to compete or even share a stage with someone who has shown physical discipline is not discrimination. It was a choice. I will also go so far as to say we understand that it is unfair for women because a woman of average beauty can have an average life. A woman of really high beauty can have an above average life by most intensive because women treat her better as well. But a woman of below beauty standards has a disproportionately difficult life. That's something men don't deal with. However,
yes, exactly.
However, it is not the responsibility of society or a Samba school to lower their standards to accept those who couldn't ordinarily cut it. Because we're not talking about racism here. We're not talking about quotas for schools for people who are denied education. These are people who chose to go down the ugly path, and now they want to act like there's no penalization for it. I don't expect to be able to be as charming as I am if I weighed 300 pounds or 150 kilos.
No, but Mo is on the other hand. Mo is saying that in America he can't blame those people because those people are poor. But in Brazil, like you can't blame the fat person because they had a choice. Like everyone has a choice in America.
Well,
even in America, you have a choice. You do have a choice in America. You have
less of a choice in America, which makes it harder. Which is why more people here are obese.
Right. So, and poor people in Brazil have less of a choice than rich people.
Choice and no choice are nearly the same thing. That's like saying that people are choosing to die more frequently because they're poor. Well, you could. I suppose you could spend all of your money and time focusing on making your health great without health care.
Right.
Yes. But on the other hand, though, if you have less options, you have less to work from.
Right.
I have a lot more options and choices than your average person for ways that I do things. And if I was going if we're talking about like a competition versus a job equity, those things are entirely different, and we can't even compare them because it's not reasonable. When you're looking for a Samba competition, you went to the Samba competition to be entertained. You saw people that were not entertaining because they can't hit the mark of what that is. We can't celebrate their mediocrity based on them making what seems like more choices that most people in Brazil don't make. That's unfair. But realistically, these are all fictions anyway. And we have to decide based on like cultural dimensions of society, which ones are the more reasonable ones. Most people are making reasonable decisions there. Some people are not. Should we celebrate unreasonable decisions? No.
Okay. I'll agree to disagree.
I love singing. I really love singing. Like John Legend, oh man, love his music. Wish I could sing like John Legend. But if I show up at a competition to sing, I expect to be booed because I can't sing for shit. It doesn't matter that I'm a skilled person in medical care, that I can do tons of other things in many other aspects that people can't.
Right. In
this specific judged situation, I am not qualified to do it, and I expect to receive criticism when I attempt it. And every time I attempt karaoke, I'm reinforced in that, and I deserve it.
Wow.
All right. I mean, you're not wrong. You're not wrong. I wouldn't say you're 100% right, but Okay,
I think we should be nice. I think we should be nice to
100%.
them. I'm not going to boo them,
Right.
but will I hang around to like if the larger samba competition at the end? Will I hang around and stay and watch it? No. Will I stay and boo it? Also, no.
I mean, I think so. Here's the thing. So Samba and what Samba represents, Samba has always been a place that has given space for marginalized people on the outskirts of society.
Yes.
So if you're on the outskirts of society, which fat people are in Brazil, there's a space for you in Samba, and that's how I'll end it. You know, it's not like no one's saying, "Oh my God, these girls are amazing," but there is a space. There is some form of representation for your section of society. Like, geez, like everybody looks away, right? Everyone's like super fit, you know, and then you have like what's at 8 girls, and everyone's making a fuss over 8 fat girls.
I thought a larger conversation of this was like, I thought it was an anecdote, but I thought the larger conversation is, should we celebrate mediocrity in certain situations to be nice? And the answer to that for me is no. But on the other hand, do I feel that we should mock them or attack them? Absolutely not.
No.
If I was there and people were booing them, I would yell at the hecklers for booing them. But I'm not going to stay for a Samba competition or something, a physical, like a visual demonstration and performance that I want to see. Will I stay to see people do it less well than people that are good at it? No.
Okay, so what do you think about female sports then? Because if you think about what do you think about female sports? Because if you look at the numbers, like
Venus Williams is the best athlete of all time. Like female sport, like I said, if we look at sports, we can look at the Williams sisters or Venus Williams, who's the best athlete all time, not the best female athlete.
She is a anomaly. But when you look at the sport, I'm talking about the sport, not one person. I'm saying the sport. The male section of sports, the feats that these men do are all, a majority of the time, if not all, you know, a lot more, how can I put this, quote unquote, impressive than what the girls do. Let's put it that way. So what does that mean? That means that
I disagree, first off, but
in terms
also,
of what?
too, I don't, well, first off, so just to, I don't know, clarifier, I don't really watch a whole lot of sports. I'm absolutely down with kneeling, and I do not watch NFL games or football games that do that. So if we're talking about like from a football thing, there's not really a strong female presence there. I do like fighting. I like enjoying watching fighting. And I'll say armbar by Ronda Rousey is equally as entertaining as an armbar by any other male athlete. I think that a knockout when female fight and do MMA, I love watching that as much as I like watching males. There's no difference for that for me.
But what I'm trying to say is that, for example, a woman won't break Usain Bolt's record. Like it's not gonna happen.
Right.
Most people won't break.
It's not gonna happen. It's not right. Right. Most people, a woman won't. Right. You know, and this is not being feminist. This is not me being male chauvinistic or whatever, but like it won't happen.
Oh, are you apologizing for having an unpopular opinion?
Am I apologize for having?
Your hesitation speaks volumes.
I know. I like being diplomatic. I like being diplomatic when I speak. Let's put it that way.
But I mean, is your main point saying that you feel that female sports are not as exciting as male sports, and it's unfair?
What I'm saying.
I just don't understand your point where you're going.
No, what I'm saying is that if you guys feel that way about, okay, this person is underperforming just because they're not doing it as well as that group, could you use the same logic to justify why you don't watch female sports? Because what goes on? I'm not talking about. Listen, just let me finish. I'm not talking about individual athletes. I'm talking about the sports in general. When you look at the records, human beings, fastest human beings in the world, those are men.
Yes.
You look at the stats in football, men. You look at the stats in almost every sport, men. Yeah. Does that mean based on the logic of you guys, right, that these women shouldn't be watched or properly given a space because a woman will never run nigh break Usain Bolt's record. A woman would never run 9 seconds.
You know what? Can I take this with Maurice? Because I think you're about to be mean. I've seen that face before.
What? No.
Go for it, Watt. Go for it, Watt.
Because what we have here is a situation
Right.
where you're applying a false equivalency, and I'd like to go into what that means.
I know what that means. What was
Okay, let me give you your example then. You're saying
Right.
not watch any women's sport because they are not as good as the men. What
Right.
I am saying, and if Maurice is with me, you can agree or disagree, is I don't watch the majority of men do sports because they're not good. When I go to YouTube to watch a jiu-jitsu competition, I'm not watching the junior Las Vegas division jiu-jitsu competition unless one of my buddies is in it. Shout out to Cobra Kai Jiu-Jitsu. But what I
But you
will
don't.
watch are
But
the
you don't watch team sports. What? I'm talking about
Yeah.
team sports. You don't watch team sports. You watch individual sports.
Jiu-jitsu is a team sport, but let's go to a different sport. Weightlifting. When I watch a powerlifting competition, I'm not watching
That's not a team sport. What?
I'm only watching the top percentage of people who can perform well. Man or woman. I watch Simone Biles. She's the only gymnast I know because
But
she's
what I'm saying, the top 10% of men who play football, of people who play football, the top 10% of people who run fast, they're all men. What?
yes. So I watch
Right, exactly. So
So do you
basically,
think that
you're
it's
saying
unfair that you're not into male gymnasts and male figure skating because they're just as good as women, but they clearly don't get the same
So what?
produce, the same press, the same amount of advertisements as females that do it. So I guess that's unfair too. What we're saying,
no, I don't understand you. You said what?
no, I
Gymnast
said
or-
that. And so for sports that are female dominated, is it
Like?
unfair that you don't
Like?
ballet? Ballet is a performance art ran by women. I can't remember the name. What's her name? Misty Copeland? I can watch her all day. But I don't watch any of the male guys do it. I don't know why.
Rarely
I've
have
never really
female
wanted to
dominated.
watch a male
Yo,
ballet.
you rarely have female dominated sports.
Brother
You
Andre,
rarely have female dominated
cliff
sports.
here for a minute. Let me jump off the cliff here for a minute. Feel free to come with me if you want. I
Right.
watch men's sports and competition, and I watch women's sports and competitions. However, I will never watch a woman's competition and hold her to the same physical standards of men because women are different. So I am okay watching a woman who is only half as fast as Usain Bolt, only half as good as Leandro Lowe at an armbar, and only half
Right.
as strong as Theodore Jorbison, the guy who plays the Mountain on Game of Thrones. But I hold them to a different standard because they're women. I will watch them perform as the best woman could because I only want to watch the best. I would watch a competition with the best transgender, transsexual fighters in the world. Personally, I think they should open a league with the best athletes on steroids in the world because I only want to see the best ones of that division. I am not going to watch that guy who wants to enter the transgender division without any hormones just because he's wearing a wig and think he should be treated the same as somebody who committed to a surgery and is on hormones because he's not as good.
All right, so you're saying, so you're saying with the girls, you're comparing the fat girl with the slim girl. You said, I'm sorry?
Yeah, I think you're talking about the difference between equality and equity, and it's important not to fudge those and pretend that they're the same thing because they're not.
Okay. Well, listen.
Equity is the ability for people to be able to have a chance to compete in certain ways and things like that, which I 100% believe in. Equality is believing that everyone's equal, and everyone is not. Everyone should be given chances and opportunities, and I watch things that are entertaining. I'm not a huge sports watcher, so I don't think that like overall it's just not like a strong example of your point. I do understand where you're going. It's not a strong example because I watch female sports all the time. I watch female weightlifters.
I'm not saying you personally, but the world. But the world
better than a lot of male weightlifters.
No, so what do you
female?
No, but what do you think about?
I watch.
But I'm saying one of the major reasons, or I guess the major excuses as to why female sports don't get the funding, they don't get paid as well, you know. And Serena said the Williams sisters, they complain about this all the time, right? So, is mainly if you say that, right? One of the excuses, I'm sorry, is that listen, these women, they don't perform as well as the guys. So why am I going to pay my money to see a person, a human being, that's running slower than that person over there?
But when you look at them in comparison, you're watching like a female athlete that may be running over 10-second hundreds, but all the other females running at the same speed. I think it would be a really weird thing to be at like a sporting event and you're watching female sprinters and you're like, have your stopwatch. You're like, dang, I don't even enjoy that race as much because that wasn't under 9 seconds. I don't think many people do that. The reason that these female people do not get the
Or
same
wait,
pay is sexism is a big part of it, and I don't agree with that.
You said
what?
We didn't hear you, Mo.
Oh, I said one of the reasons that female athletes don't get paid a lot of money, that's partially due to sexism, and I don't agree with that. But at the same time, we do. I absolutely.
So it's not. So you don't think it's not? No, because I'm not actually.
Is it sexism because I don't want to watch overweight dancers dance poorly?
No, I'm not trying. Listen, no. I'm not trying to defend that point. I'm not trying to defend that point. Right? I'm not trying to defend that point. All I'm just trying to say is that in my head, a person with your point of view, right? I think it's kind of like weird that, like, in one instance, you're like, I would not support this person because this person underperforms. Right.
I think blanket statements and not having changing views based on circumstances are the idea of dogma or people not truly thinking about issues. I have lots of different things because culture and my ideals about how culture and the world are definitely changed based on the situation. And when you try and compare them and say that they're all the same thing, I don't make blanket statements for how I feel about a specific thing, about how I feel about like lots of things. In specific instances, things change.
You think, okay, fine. Yeah, that makes sense.
But if we want to talk about why most of these problems are, it's white men. That's the only blanket statement I'll make. Most of the problems that I have with most things are white men. That's my blanket statement for the day.
Well, agreed. I mean, white women as well. White women as well. I don't like separating them.
Gentlemen.
By the way,
on that note, we all have to listen. I got stuff to do. I don't know about y'all.
Yeah, I got shit to do as well.
I want to let you both know that I appreciate it. I want you both to know that you're always invited back. Okay? Let me think. I want you both to know that you're invited to any of the bigger, larger group ones that I have, and you've both seen them. And I think you'll enjoy those.
All right.
You know, is there any, you know what I'd like to know, are there any parting words you have? Anything that you want to do to wrap things up?
I mean, listen, like I heard about your accolades and stuff, Mo. I just want to know, like, about you as a person, like, where you from, and like, you know.
Okay.
Yeah.
My name is Mo. I'm from Las Vegas. That's where I grew up. I live currently right now in Lincoln, Nebraska.
Wow.
Big into lifting, bodybuilding. Big into shooting sports, shooting competitions. Are a big part of my day. Love building stuff.
Oh,
pretty normal, average stuff. My interests, primarily like professionally and like in personal life, are a lot about activism and about equity. And equity of healthcare, equity of life, equity of experiences are like what I believe in. So that does that answer your question?
Yeah. Nice.
And the same to you, like I definitely think we need, like, after this is over, I want to exchange contact information with you because I want to understand better about public healthcare systems, because I have an interest in public healthcare and I want to see some of the things that you guys do so that I can at least bring those things into my practice. I can't change the whole United States system, but I want us to be more like that, obviously.
Right. It's funny because, like, in Brazil, you know, we do have a lot of problems, especially when it comes on to, like, you know, corruption. I'm not saying all country. I'm not saying that, you know, Brazil is special for having corruption, but, you know, a lot of our system could be a lot better if the funds were allocated where they should be. You know, so but on paper, trust me, it's good stuff.
I believe you.
It's good stuff. So so yeah, we should definitely talk about this, you know, some other time.
Well, you know what? Can you, before we go, Andre, can you tell them about the program you came through?
Right. So like I said, I was born in Jamaica, right? And I came to Brazil when I was 19 on a scholarship that Brazil offers to nationals of, like, poorer countries, Jamaica being one of them. And I got a scholarship to study dentistry at the University of Sao Paulo, which is ranked the best university in, you know, South America. Latin America in general, you know, better than a lot of schools in the U.S., in North America at least. So yeah, I came here. I've been here for, you know, call it 10 years, and yeah, I've been living in Brazil ever since. The scholarship they afford you the opportunity to study not only your field but understand Brazilian culture. like it's more of a cultural exchange. So we studied, when we spent a year learning Portuguese, and during that year we studied like Brazilian history and Brazilian literature, stuff like that. As a way to basically try to understand what we see here in Brazil. So and that basically sparked my interest in like understanding like the geography of Brazil, the history of Brazil, the politics of Brazil, because it's one of those things where a lot of people, when they go to someone else's country, they see a lot of things, but they're not really interested in figuring out why. They're mainly interested in like, oh, in my country it's not like this. Oh, there's some bullshit because but back in the States or back in Jamaica, blah blah blah. But I consider myself a very open-minded person, so I'm very enthusiastic about learning why Brazilians do the things they do, or why did Brazil even have public health care in the first place? And like I said, like that happened after the Kinship, where the country was basically in a very rough position, where they literally clicked restart on the country. They rewrote the Brazilian constitution is actually younger than I am. The current Brazilian, like they literally rewrote the rules of the country. Like we're a different country. We believe this, blah blah blah. So like stuff like that. That's what I like to talk about and stuff.
Very cool.
So,
yeah. I definitely have sentiment for that. I don't know. I grew up being very, very pro-Black always. Black Panthers, some of my heroes. Also made me kind of strong for socialist leanings. I'm actually traveling to Cuba, and I'm going to get a chance to check out some of their healthcare systems and implementation. So I always look forward to like learning things from how people do it all over the world, because we can see and look at healthcare outcomes here. And we can basically see that we don't do everything right. And a lot of other countries get it a lot more right than we are. No country gets it perfect, but other places get it a lot more right. So I'm always looking for answers and solutions to help all people from disadvantaged populations, because, all the power to all the people is what I believe and live by.
It's funny that you said that, because in general, like I find that in third world countries, we study America way more than America studies us. That we like, I mean, growing up in Jamaica, like you're not a intelligent Jamaican unless you know about America. And let me tell you, like even like in school, we learn a lot about America. Like you can ask a well-educated Jamaican, he can tell you American history. He can name all the states.
Probably better than your average American.
Better than the average American. Brazil is no different, So it's very refreshing to like hear an American say, "Listen, I wanna." See what's going on the other side.
Well, my life was changed similar to yours. I think I was 16 when I went to Argentina, and I had a view of like they have socialized medicine there in many ways. And I had a similar doctor's visit to Watts, and I left my wallet. They're like, "Why do you even need it? Who even cares? Come in here and get this healthcare." So my view has been changed from a very early age on how different socialized systems of medicine work more efficiently and more cost effective than we do here.
Yeah. It's funny because while I'm in America, I get super nervous. Like if I got a call, like seriously, like I'm paranoid. I get paranoid because it's like, it's like, like I don't want to get a cough. If I get a cough, I'm like, geez, check, like because I can't afford it. And one of the things I do is that every time I'm in the States, I always have my med kit, because because it's very expensive. I always joke about this situation with like condoms, which for some reason, I don't think America actually views condoms as health, because it's so expensive.
And it's politicized to a level where it's not even health. It's about like God and Jesus and other things that don't matter.
Right. Exactly. So I always tell Watt that, like, I remember the first time buying a condom in America and having to contemplate, wow, is this sex really worth it? like, is it really worth it? Like, is this girl really worth it? Because I was shocked that condoms were so expensive.
More expensive if you don't use them, though.
Which is crazy. No, I'm telling you, because listen, in Brazil, you can get the day after pill for like R$7, which is like the equivalent of like maybe $2-3.
Yeah.
The morning after pill in America, that's like $100, right?
Or more.
Or more.
Right. In certain places, pharmacists can decide not to give those medications sometimes.
You're lying.
I wish I was.
Are you serious?
Yes.
Wow. Jeez. God.
They can be conscientious objectors to people receiving certain types of medications.
Right.
Wait, what? Wait. So you're saying
I didn't stutter and you didn't hear me wrong. It's as bad as you think it is.
wait. So you're saying that I can go to the pharmacy and be like, I want a pill. They're like, no.
Yes.
Why?
They're conscientious objectors, and it's kind of one of those things that I can't explain the reasons behind something that I totally don't agree with. I can't tell you why.
Is that national? Is that national, or is that like?
I'm pretty sure in most places that's absolutely acceptable. But you can be a conscientious objector to filling certain prescriptions and things like that. Yeah.
Wait. So like so I can take my prescription and they can be like, I don't believe in giving you this medication. So.
And you're like, it exists, and they're like, yeah, we don't believe in it. Yes.
Wow.
Wow.
We'll talk about that another time.
Yeah.
Absolutely.
Wow.
Thanks for having me. Thanks for having me.
All right.
I love the mustache. All the power to all the people. Take care, y'all.